All right, good evening, everyone. Thank you very much for joining us. My name is Joel Torres. I'm the Senior Manager for Family Connections Adapt Coalition, and we truly appreciate you taking time out of your busy evening to join us and our partners in a um, brief webinar discussing tackling opioids through prevention for student athletes and a toolkit that was developed by the state of New Jersey to assist parents, athletes, athletic directors, and other individuals in assisting with this issue that has been a top priority of the state and of our regional coalitions, which ADAPT is one that supports here in Essex County. So, without further ado, just want to give some very brief background information because we have some two amazing guest speakers here for us tonight. But we also have an intern here at Adapt, Ukpa, who is also a student athlete, and he'll be working with me collaboratively in the beginning of this presentation to give you some background information that'll help set the tone for what you'll be hearing tonight from our two presenters. So before we begin, I want to thank, of course, our possible the collaborators who made this event possible with us tonight. Of course, the Nutley Municipal Alliance program and the coordinator Sam Corella, who is joining us this evening. Uh, Along with that, we have the Essex County Municipal Alliance program, which is run by the county's Division of Community Health Services. We have the director Eileen Fishman joining us, along with uh, the countywide coalition coordinator Elizabeth Marks as well joining us. So we thank all of our great partners for making this event possible here in Nutley with us tonight. Very briefly, just to touch base on who we are, so you can put a picture to the team itself. Adapt is made up of myself as a senior manager. We have Julia Herrero, who is one of our coordinators. We have Jessica Delgado, who's another coordinator here to Adapt, and Emmeline Falcon, who is a youth prevention specialist. So this is a team that makes this possible. Today's presenters, as I stated, we have Ukpa, who's a student athlete and also an intern here to Adapt. We have Nutley's own Detective Sergeant Mike Padilla, and also we have Dr. John Kaufman joining us, and we'll touch base a little bit more and introduce them a little bit more later on. Very briefly, before we begin, just for those who do not know much about who we are in ADAPT, we are a group of volunteers, both youth and adults, who are focused on preventing and reducing underage drinking, substance use disorder, throughout the entire county of Essex. So we work very closely with our local partners like the Nutley Municipal Alliance to work on prevention programming. We also work on empowering our youth leaders and community members and on building collaboration to make sure we increase education and awareness. But our long term goal is to advocate for local and countywide programmatic and policy changes that can occur to reduce substance use here in the county itself and increase prevention and the resources that are allowed. We're funded through various grants that include the state through the Division of Mental Health and Addiction Services and through the White House's Office of National Drug Control Policy. And we are managed by Family Connections, which has been around the state of New Jersey since 1879. And no, that's not a typo. Since 1879, the agency has been around Essex County and the greater northern New Jersey community, investing in the well being of our residents and also trying to build stronger and safer, healthier communities here in the area. Our focus at that, we have problem areas that we look at: underage drinking, prescription medication misuse and abuse, tobacco use by minors, and other substances that might be used or are high trends, such as the use of marijuana, the use of heroin, things of that as well are things that we focus on depending on what the needs are in the community. Our goals are to decrease youth access to alcohol and drugs and to reduce misuse and abuse of prescription medication by all individuals. And this is one way that we do it by these type of presentations where we're talking specifically about the student athlete population and the risk of prescription medication misuse and abuse by the population. We have four committees that we focus on. One is underage drinking, Another is focused on prescription drugs. These focus on various initiatives, prevention initiatives based on these substances. We also have an interfaith committee that focuses on implementing initiatives to expand prevention programming and resources with our interfaith community. And our most recent committee we have is focused on the LGBTQ plus community and looking to expand services and programming for the LGBTQ plus residents of the county itself. What we do is based on science, so we follow what's called the strategic prevention framework model. That's looking at beginning with assessing, trying to find out what's going on, and you hear kind of the same language. You assess a problem before it happens, so you assess an injury before you go to diagnose it, or not diagnose it, but try to treat it. That's the same thing we're doing here. We're assessing a problem. We're looking to build capacity, build relationships, start planning, implementing, and evaluating the programs, and always being culturally competent of the communities we serve, and looking to make sure that whatever we put into place is sustainable. So if we're trying to advocate for student athletes and making sure that we reduce prescription medication misuse and abuse, it's how do we make that sustainable over time and not just do this one event tonight and think, yeah, great job, we did a good job tonight, and that's the end of the story. That's not the way we operate, and we want to make sure that we continue to support the community and support the reduction of risk that's happening. So, with that said, we'll briefly discuss our the TOPS presentation, discuss a toolkit that was created by the state of New Jersey, and then we'll pass it on to our presenters here. So, Uwam will be joining me in having this dialogue regarding the top toolkit that was created by the state of New Jersey. This was created 4 years ago by the Division of Mental Health and Addiction Services, along with the New Jersey Prevention Network. And we actually will include during this conversation in the chat for you to have a link to an electronic version of the toolkit so that you can have it accessible for you. And afterwards, after the event, we'll send you an email with a survey, but also with a copy of this presentation so that you have it and you have the information readily available. So first and foremost, the easiest question that people ask is what are opioids? Opioids are a class of drugs that include the illegal drug heroin, synthetic opioids such as fentanyl, which is heard a lot now, and is leading to unfortunately many overdoses and many overdose deaths. And it also includes pain relievers that are available legally by prescription, such as oxycodone, hydrocodone, codeine, morphine, and many others. When these are used correctly and most importantly under healthcare providers' direction, uh, they can be helpful. Prescribed pain medications can be helpful dealing with pain. However, if you misuse these opioids, these prescription opioids, there is a risk for dependence and addiction. And statistics and data is out there that as it pertains to youth and teens, uh, there's a short amount of time, and this is why the state has created a law where, uh, say for example, and this is what I'm telling you as a parent is because my child had her wisdom teeth removed, and the dentist gave her a 10-day prescription to prescribe painkiller. Uh, Thankfully, being educated, we did not offer that to her. We went with the high strength Tylenol, but we had a conversation with the dentist of the state law is 5 days, so 5 days maximum of a prescription for now, because of that risk of dependence and addiction, especially when you're young. So just be aware of that, and you can always be that advocate for your child and have that conversation with your medical professional to make sure if you do not need it, there's no reason for you to have it. If they do prescribe it, it should only be a 5 day maximum of the medication. The opioids are used to reduce the intensity of pain signals that reach your brain through the opioid receptors on your nerve cells, and they affect the brain's reward system. So the more that you have, the more that you feel a certain way, the more that you want to continue to have the pain go away, so you feel like taking some more, and that's where you can lead to some dependence and some addiction issues. With that, I'll pass it on to Uam to speak a little bit about the statistics around uh, opioid abuse. So, Uam, go ahead.
Good evening, everyone. Preventing opioid abuse is important mainly because approximately 115 Americans die every day from an opioid abuse that doesn't opioid overdose, that doesn't mean necessarily um, only prescription painkillers, but prescription painkillers can lead to overdoses in heroin and meth and things of that nature. People who abuse of opioids are 40 times more likely to become addicted to heroin because it's more easily accessible to get once you're already hooked on to the opioid itself. 1 out of 4 people receive long-term opioid therapy in primary care settings struggles with addiction, and approximately 3 out of 4 new heroin users report having abused prescription opioids in the past. And that's just on the adult side. In terms of youth and adolescents and student athletes in particular, about 1 in 3 young people get pills from their own previous prescriptions, and about 83% of adolescents do take prescription medicine unsupervised. So you heard Joel say that he was involved in his daughter taking prescription medicine and decided to use an alternative method. About 80 to 83% of adolescents don't have that type of supervision in their life, and they're taking on their own accord. Roughly about 12% of males and 8% of females in the 2018-2019 season were given prescription painkillers, and about 50% of high contact sports, so basketball, rugby, football, are 50% of them are more likely to, they're 50% more likely to take prescription medicine. And also, male athletes in particular are 4 times more likely to take or
I think
misuse.
your I'm sorry, I think your Wi-Fi is a little weak. You're breaking up. We got a comment saying that the sound was a little choppy. So if you want to check that real quick, I'll come back to you. Don't worry about it. I think those statistics were very important, and I think Uam was giving you more insight into athletes and opioids and the fact that there's a greater risk of injury or receiving opioids from teammates. So just be aware of that and be wary of that. Uh, a study of 1,540 adolescents found that participating in high school athletics made it more likely for young men had taken or misused an opioid prescription within the last year, and this is what Uwam was just mentioning and talking about. So just be aware of that. Yeah, it's still it's breaking up, but don't worry about it. We'll work through it. So we wanna notate this and just make it very clear that these common signs do not mean that your child is dealing with an opioid abuse challenge or dealing with a substance use disorder. Uh, if you have a teenager, you know full well that some of these just come with your child. But these are some signs that you should be aware of, just in case they are distributing or showcasing a lot of these signs. And it's something just to be aware of that it can be related to opioid abuse. First and foremost, falling asleep at inappropriate times, withdrawing from their commitments or their activities, having dramatic mood swings, having difficulty focusing and an inability to concentrate on tasks, having changes in their appearance or their behavior as well. So these are some things to just be aware of when it comes to common signs of opioid abuse. The top toolkit, like I said, once we have our presenters starting to speak, I will, in the chat box, include a link that you can download a PDF copy of the toolkit itself. So you'll have that within your the chat box in about 5 minutes. So just give us 5 minutes and we'll give that to you. It has some data, some information, but also breaks it down if you are an athletic director or a coach, if you're an athletic trainer, a nurse in a school, or a parent. It gives you some tips and some information. For our athletic directors or coaches that might be here, Detective Padilla will give you some more insight into this, so we don't want to take up too much time. But just make sure you communicate with your athletes about their injuries. Make sure that returning to play decisions are based on medical professionals. Document any treatment or the return to play plan, and give folks time to heal. If you're an athletic trainer, just make sure you increase your presence. So, uh, advocate for more full-time athletic trainers within our school districts, sharing information and assisting the student athletes in their recovery progress and monitoring the medication that's being used. And for both our athletic trainers and our nurses, just being aware of where naloxone is stored in the school districts or in the school buildings. There is a state law that was passed 2 years ago. uh, so we included the citation of the state law just in case you're not aware of it, or just for families to be more educated on it. uh, it's related to the emergency administration of the opioid antidote known as naloxone, and it's just to be aware of the fact of where this emergency administration can occur or should occur, when it should occur, things of that nature, where you should store your naloxone. Just be very aware of that. The toolkit gives you some more information and background on that. For parents, just being aware of the trends and some of the other challenges that your child might be dealing with, where they might be self medicating, having open dialogue and discussions, making sure that you're properly monitoring, securing, and disposing of your medications. And after our presenters, we'll give you some more information on that and give you a highlight on that. And we have some resources. So there's drugfree.org. There's a 1-800 number that you can call as well. And just be aware that you as a parental figure are an important asset to the conversation and to the overall success of your child. uh, Alcohol and drugs are very accessible to youth, either from the homes themselves, from a friend's house, or the local community. So uh, your involvement can help reduce and prevent substance use, especially at a young age. So we all know we live busy lives. The pandemic has kind of shifted that and given us some more time to be around our family. So that family communication is very important, very ideal. And also, you can display what a positive role model looks like. Being actively involved is always important. We know we all live busy lives. We might not be able to be actively involved day to day, but sharing an interest, sharing a hobby, showing interest in what your child is doing, teaching them how to have respectful dialogue and respectfully voice their opinions, and letting them do so, and share your own experience when you're comfortable doing that. And just make sure that we always want to make sure that you understand that you should be a primary and accurate source of information for your child when it comes to drugs and alcohol. um, and be that accurate and factual, because everyone has a cell phone now, and if you say something that's not factual, they can search it up. And if they lose trust in you as a trusted source, somebody else, a friend or somebody who might not be giving them the proper information, will provide them with some insight that might lead them to unhealthy behaviors and activities. And always lead by example. Don't serve alcohol to your children or their friends if they are under 21 years old. Monitor your consumption of alcohol around them. Promote healthy alternatives to cope with life and to build resiliency and to manage pain other than dealing or taking prescribed painkillers. And there's always opportunities available. So we have youth leadership opportunities through ADAPT that your child can participate in, and we'll talk about that more afterwards. But I'll let Uwam touch base real quick on the rice method, and then we'll get to our presenters. So Uwam, if we're good with the,
I believe we're good. We're good,
uh,
right?
yes,
All right.
beautiful. Go ahead.
So the rice method, rice is I forget the word now, but each letter means something. So R is rest, I is ice, C is compressed, and E is elevate. Um, Rest meaning try not to move around the injury too much. I play rugby, so I dislocated my shoulder and I ended up not going to the hospital for it only because it wasn't that big of a deal. All I had to do was rest on my arm, apply a little ice, the I, about 20 minutes on, 40 minutes off. Some people say 20 minutes on, 20 minutes off, but it's basically up to your discretion of how you want to apply that ice. Compressed, wrap it up. There's ace bandages. There are a couple braces that are pretty good in injury healing. And elevated, you just want to lift it up a little bit if it's your leg. Try to go to bed with maybe a couple pillows under your legs just to lift it up. Your arm, you want to have it a little bit propped up so it's not. You want a little bit of blood moving through it. You don't want to just have it lagging because then it'll just prolong the injury. I have a friend who unfortunately had to drop out of college because of opioid addiction. He was prescribed it over breaking his leg, and he has never been sane. He has gone to rehab about 3 times for it. And I'm sure if he was in this discussion, he'd be very, very, very vocal about the Rice method and trying to stay away from prescription medication as much as possible.
And now, most important, we have our guest speakers here tonight. First and foremost, we have Detective Sergeant Mike Padilla, a Nutley police officer and a local coach. He'll be touching base from the perspective of a coach and a parent. And with that, I will stop sharing my screen. You will, in your chat box, I'll drop the link for the toolkit. And also, if you have any questions, there is a Q&A button. You can click on the Q&A button. You can type in your question. After the presentation, Detective Padilla will take those questions. We'll make sure to field them and ask them for you. So don't worry about that. But without further ado, I will stop sharing so that Detective Padilla can share his screen.
We're good?
Yes.
Okay, so again, my name's Detective Sergeant Mike Padilla. I'm from the Nutley Police Department in Essex County. I've been a police officer for over 20 years and been a certified personal trainer for 27. I have an AS in exercise science, and I'm certified by the Police Training Commission as a physical training instructor. I've also been a high school football coach for over 12 years. I want to take a minute to look at this video real quick.
I think we see Willis coming out. There he comes right now. 6 feet 10 from Grambling. The captain of the next, the most valuable player of the NBA.
All of a sudden, this guy comes out, not limping, I'm talking about dragging his leg.
When Willis walked out, I couldn't believe it.
All over the arena, jaws were dropping.
They were just screaming and yelling. The decibel was outrageous.
I've never heard that kind of roar and uplift in the Garden, ever.
So you okay? Can you go on? Get him a body bag! Yeah! All right. Feet. Warning for illegal contact with the knee. Johnny! Yeah. No mercy! No mercy! Play the face, Johnny! Finish him!
So this is what you see on TV. This is what you see as success in movies, and that's what the culture creates. So kids think that they got to push through and play hurt. And the reason why is because they think they're invincible. Kids don't think bad things happen to good people. They'll let their coaches down. They'll lose their spot. Family and friends expect them to go back in. And any chance at the next level could go away if they don't play. You know, who knows who's watching right now. And they know they don't make movies about the kids who don't come back in. So being around sports and being around the police department, you come in contact with a lot of kids. So one kid in particular was a sophomore. He was on the verge of getting a starting job on a very good team, which is tough as a sophomore. strains hamstring. You know, after a long discussion, because everybody wants to go back in and play, you know, you had to go see the trainer. So basically they got sidelined. So they initially regretted it because they lost the opportunity, but got healthy and eventually gained that starting spot as a sophomore and ends up having an outstanding high school career that actually resulted in a college scholarship. But the question is, what could the story have been different without taking the time to treat that injury? Because, you know, you have one injury, it could lead to a secondary injury or compensatory because you're not treating the first one. And then instead of having, you know, 1 or 2 games out, maybe you miss a season, and then you never know what could happen beyond that. Because if you get a chronic injury, you're always banged up and you're always missing time in games. Subject 2. We got a phone call of a report of a possible suicidal teen called in by a third party. You know, upon arrival, the officers found out that the person had taken one of their father's oxycodone pills. Didn't display any signs of self-inflicted injuries. So how do you handle something like this? Well, after talking to the parents and getting an idea what was going on, they had heard about our station house adjustment program, which that's something from the Attorney General, where it offers the opportunity for police departments to work with youth rather than sign complaints. In this case, we wouldn't have signed a complaint, but because they were aware of the program and what we did within it, they asked us if we could do that with them. So with that, we worked on them getting counseling and helping them get that, and also having her write a paper about what happened so that we could then, you know, find out what was going on and making sure that we were getting the right things in place. So what was said was I was in pain and wanted to go to bed, sports-related injury. And 2 years ago, the father had hurt their foot and would take them to ease the pain. It was still in the medicine cabinet. So what could have happened? Could have had an allergic reaction or become addicted. And what could you have done differently? Now, this is coming from that person. Talked to the trainer, iced my ankle, spoke to my parents. So what changed since that event? Well, through this whole process and through family counseling and everything else, they had gotten closer. They started having dinner together. She started studying more and paying attention to school, emailed teachers, and then had a better relationship at home. Went on to a full athletic scholarship. But what could have happened? So through the Center of Disease Control report, a single day supply of a narcotic painkiller can result in 6% of patients being on opiate a year later. So think about that. That's 1 day's dose. Long term, after 5 days of taking the drug, increased greatly. So you're talking about 13% more after 8 days or more. So that means 1 out of 5 people after 8 days could be on this for more than a year and having a problem. And knowing that athletes are at 50% more high of a risk than on non-playing counterparts, this puts a lot at stake for athletes. So dispensing rates in the United States. In 2012, for 100 Americans, there were 81 opioid prescriptions were written. 255,207,954 prescriptions in 1 year. 2017, it was 58. And then the average number of days per prescription in 2017 was 18 days worth of a prescription. So if in 8 days you could have a problem, you're taking a year, what's 18 days going to do for you? And that's an average at 3 pills a day. You're talking about 54 pills. So even if you weren't taking them at the time and you had them around, they were accessible. In 2017, New Jersey took some steps to limit prescriptions for acute pain from 30 to 5 days. Even that, you're talking about 15 or more pills based on an average dose. In 2019, which is just 2 years ago, it dropped down to 47 per 100 Americans, but it's still 153,260,450 prescriptions issued. In 2017, New Jersey was the first in the country to start doing some stuff about this with notifications. And after they started, a study was done, and nearly 5,000 fewer patients were given new prescription on opiates in the month after law's implementation. Doctors who routinely warned patients of the risk increased from 18% to 95%. And clinicians who prescribed opioids for acute pain dropped by more than 1,000 after this law went into effect. In New Jersey, it was the first in the nation, and recently, and I believe it was actually Monday, it was introduced by Congress to help opiate addiction nationally. Less pills and more education is great news, unless you're addicted, because the less availability of pills means that you're faster to go to heroin. And prevention is the best, because outpatient medical therapy for heroin is a 35% completion rate. That means out of the people that go to an outpatient, 35% of them finish it. Residential is 65%. So obviously it has a better success rate, but that's again just on completion. But according to drugabuse.com, relapse rate for heroin is believed to be over 90%. So it's not a high success rate. So with cutting down on the pills, which is a good thing, you know, the only thing that's available if you can't get access to them then becomes you know, counterfeit pills, which contain fentanyl in most cases, and heroin. According to the CDC in 2018, 67,367 drug overdose deaths occurred in the United States. Of that, 69.5% were opioid related. These stats may work with some kids, but my experience is that unless a safe falls on a kid, when you tell them something's going to happen, that they don't always believe that it's going to happen to them. So I went to an interesting presentation when I was at a lead conference, and it was a guy who was with the Olympic Committee. And he basically sat there and gave stats on athletic performance. So I thought it was a great presentation and a new angle to try to get kids to understand. So, you know, I didn't get there and tell them that alcohol and marijuana were bad for them. I said, you know, basically, you've heard that story before, and obviously that's not working for everybody. So let's talk about what you want. And, you know, when you talk to kids about, you know, the carrot and the stick, I call it, you know, you're motivated by what you want out of life and what you want to be successful, or for the problems and the trouble that you get into for not doing the right thing. So, you know, most kids want to make it to the state finals, or they want to be top in their sport. When you break it down how these type of things affect your athletic performance, I could tell that these kids and the looks on their faces were surprised. I thought it was a lot more effective based on the fact that they're already hearing all of those things about how it's bad for your health in school. It's not that we're not saying that, but we're saying it from a different angle. I tried to find what I could on the effects of opioid and athletic performance. And, you know, slower breathing and heart rate, you're going to tire quicker and you're not going to be able to perform as much. When it interferes with your nerve transmissions and electrical stimulation in the body, it's going to be a reduction from the brain telling the muscle to work, which over time causes muscle weakness and atrophy. And it can prevent testosterone from reaching normal levels. Using opioids daily for more than a month will begin to imbalance your endocrine system, which functions to regulate your hormonal functions. And opiates cause a reduction in your appetite. So people typically aren't going to eat as well as they should, which means they're also not going to fuel their body the right way. So less endurance, less strength, and a slower reaction time does not seem good for athletes. And you know, kids, when you talk to them about injuries, you know, here's the most common reasons why kids actually do get injured in the first place. Now, as coaches, we're preaching them all the time about they got to be in shape. They have to you know, make sure they're treating themselves the right way, and they're talking to the trainer, you know, that they're staying hydrated, you know, getting the right amount of sleep, but they don't realize that all of these things can affect their being injured. From my experience as a coach, you know, trainers meet with the team every year in the beginning of the season, and they talk about how you're supposed to go about dealing with an injury. And that says, you know, letting your coaches know about what's going on and making sure that you're seeing the trainer immediately at any point in time when you're injured. And they're doing that right from the start, and they're there at practices in many cases, especially early in the season, and definitely with games. And the trainers and doctors are usually at the games, and they're dealing with what's going on as it happens. So when somebody comes off the field or off the court, you know, they're addressing it at that point in time. And they communicate with each other. When we're at away games, you know, they have their trainers. In many cases, you're getting off the bus and you're going to talk to your trainer, and your trainer has already gotten a phone call from the other team's trainer, and they've already talked about what's going to happen and made phone calls to the parents. So you have to let them know what's going on. And injuries continue to be monitored and evaluated until the kids are healthy. So once they kind of know what's going on, they give them a treatment plan. They work with them. If there's any doctor's appointments, there's communication back and forth. But one thing I've noticed as somebody who was an injured athlete, you know, you feel distanced from your team when you get hurt. You don't feel like you're in the same place. So as a coach, that's one thing I was always mindful of, is that when somebody was injured, I think it's important that you find jobs for them. Um, we had one kid who I actually called him Coach Mac. Um, he basically, he broke his arm, so we had to find things for him to do, and he basically was helping us run scout teams and hold plays up and doing coaching points. Whether it's giving kids a job during the game, who's got the kick tee, who's got the game balls. Need to keep them involved in it so that they want to stay with the program. They need to feel connected. So in Nutley, we've been fortunate. We've been kind of been involved with this thing, and we started our Hope Helping Parents Endure in 2009. It was started by our police commissioner, Director Petracco, Alphonse Petracco, and Sam's actually involved with it. We've done a lot of stuff under the influence, bringing things to parents. We had a carnival of hope where we took the stigma out of speaking about what's going on and allowing people to get help. Our lead program, we're out in the schools and we're talking about not just drug education. We're talking about character building, conflict resolution. We're giving kids the skills to talk about those things, and the whole say no thing. Well, you can tell a kid to say no, but if you don't make them strong enough to be able to say it, or how to work through these problems, you're gonna have a hard time doing it. And in 2017, prior to kicking off a lot of these initiatives, Governor Christie actually came and saw one of our lead lessons at Washington School. And adapted. That's been a big part of what we've done. They added our medicine drop box, which again, maybe if that father had known or thought about where can I get rid of this stuff rather than having it in the house, maybe she wouldn't have had that problem in the first place. Our athletic department and our school system is very involved in what we do. Adapt actually put together an opioid walk where we actually put hangers on people's doors, and we actually gave stuff out at halftime at one of our games. But we had full participation from our entire athletic department and our fall sports. Every kid in fall sports participated in that walk. And it's something that everybody in our community has gotten behind, understanding that it does really take a village to raise a child. So one thing I want you to remember is to be mindful that right now, especially whether it's sports that haven't happened, schools classes that aren't in session, kids right now are at risk more than ever because of the fact that they're not having the same social interactions. Kids generally already are on their phone. Sometimes sports are the only interaction, or clubs or school, that they have with other students that aren't through social media. So, if somebody that is having a problem, we actually have cards that we give out, like we give them out like every opportunity we get, and it has programs and services. Now, Perform Care is a 24-hour point of contact for all state services under the age of 21. So if there's anything, a parent can call up, can give them what's going on, and they'll actually send services right into the residents. And right within Nutley, we also have our Nutley Family Service Bureau. Now, Nutley Family Service Bureau also has a food pantry, counseling session, and a shop. So it's really, it's a surrounding service, a wraparound service, where if there's food insecurities, if there's something that you need to talk about, there's help right here within walking distance in Nutley that you can get. So if there is anything, please take advantage of it. The number is right there for Perform Care and on the card. And again, sometimes having that person to lean on when you're going through these times is important, whether you're an athlete or just a student. So I want to thank you for the opportunity to present and speak about these topics, which are important, especially now and today. Obviously, this is my first time presenting via Zoom. I'm usually an in-person kind of guy. So much has changed for all of us, but together we can adapt and make it work. Thank you.
If you still have any questions for Detective Padilla, please feel free to throw them in the Q&A section. We will make sure to ask them at the end. But if we do not have any for right now, we'll pass it on to our next panelist. We have Dr. Kaufman. Dr. Kaufman is a physical therapist here in Nutley, so we are very excited to have Dr. Kaufman here with us today. Dr. John Kaufman is a board certified physical therapist and the founder and owner of Core Physical Therapy and Sports Performance in Nutley. He graduated from Stockton University with a Bachelor of Science in Biology and continued at Stockton to earn his doctorate of physical therapy. He's an active member of the American Physical Therapy Association and specializes in outpatient orthopedic therapy, postoperative low back and neck pain, and sports injuries. John lives in the Nutley area and enjoys spending time with his family, coaching local youth programs, and exercising. So, with that, we'll pass it on to Dr. Kaufman.
Thank you, Joel. My name is John Kaufman. Like Joel said, I'm a physical therapist and founder of Core Physical Therapy in Nutley. I'm also a Nutley resident. I have 2 children here, one in 6th grade and one in 3rd grade, both attending the Nutley school system. And again, thank you, Joel. And I'd like to thank Detective Padilla. That was a great presentation. I really like the information on Patient Notification Act. That's some great stuff. And thank you, everyone, for speaking as well. And thank you all for attending and taking the time to let me share how physical therapy can be a safe and effective intervention for sports-related pain issues. So I'd like to start by sharing a personal experience. I had somebody close to me that ran into some trouble with opioids. He was a phenomenal baseball player. He wasn't that big. He can make contact though, crush the ball. I think he was actually like 5'7", but he was awarded a scholarship to play baseball in college. Unfortunately, he injured his knee. It was a non-contact injury. He was going up for a pop fly, pivoted, strained his knee. It wound up being an ACL tear, and he underwent ACL reconstruction. And he was able to rehabilitate his knee pretty well, but during the post-operative procedures, he was given pain medication. Unfortunately, he wound up using these more often, became addicted, and several years later actually overdosed and died. So, experiencing that, seeing what his family went through was really tough. So the risk is real. The use of opioids are dangerous, and unfortunately, some users are being introduced to these drugs after sustaining sports injuries as young athletes. Interestingly enough, I had someone recently come into my office, and they were in for a surgery, and they were not taking pain medication. And I asked him why, and he said in high school he sustained several injuries, and he began using opioids and became addicted himself, and has rehabilitated, does not use them anymore, but that's why now he's only taking the Tylenol, not using any pain medication. But it was interesting to hear about someone recently that shared that with me, about how in high school these injuries led to opioid use prescribed by doctors, and led him into becoming addicted. So I know you heard a lot of stats tonight. I have a couple more statistics for you because this is happening a lot in America. Drug overdoses are the #1 cause of injury-related death. I think in 2018, there were 70,000 Americans died of an overdose. We will mention that 115 Americans die every day from overdoses. And in the U.S., doctors, they're seeing that some studies show that doctors are prescribing opioids about 21% of the time for musculoskeletal conditions. And from the American Physical Therapy Association, they're showing that the doctors are only prescribing physical therapy 10% of the time. So they're prescribing a lot more opioids than they are therapy currently. So there are appropriate times to prescribe these medications, but the American Medical Association practice guidelines now expect doctors to emphasize non-pharmacological interventions when appropriate. These may include physical therapy, acupuncture, chiropractic care, occupational therapy, to name a few. I'm going to talk about physical therapy tonight. So what is physical therapy? Physical therapists are specialists in evaluating, treating, and preventing movement disorders. An example could be a young athlete sprains their ankle. There's swelling, there's pain, stiffness, weakness in the ankle. This results in gait deviations, unable to run, jump, sprint, play their sport. So what a physical therapist will do is they'll assess the patient first and develop a customized treatment plan, which may include interventions such as corrective exercises, modalities such as electrical stimulation, heat, ice, compression therapies, soft tissue mobilizations. These are manual therapies, like trigger point release, joint mobilizations, active release techniques. These help restore normal tissue integrity and help alleviate pain. And therapists will also educate the patients and clients on how to improve their mobility and performance and prevent future injuries. So therapy can be used to restore pain-free mobility and performance, and also prevent dysfunction and pain. So let's talk a little bit about these interventions. So I'll start with the feel-good one, the manual therapies. Everyone likes manual therapy. Unless we're digging in pretty deep, then it might be a little bit painful. But for the most part, these are the feel-good. Tissue and joint mobilizations. These treatments feel good and relieve pain. They also help restore normal tissue integrity, improving blood flow, healing, and restoring proper tissue length. An example could be a muscle strain. Maybe your athlete pulled a hamstring. I think Dr. Padilla was talking about one of his athletes pulling a hamstring. If this is untreated, it could result in poor healing, could result in re-injury, poor performance, and a therapist can do a technique such as the active release technique. This realigns those tissues properly to speed recovery and promote full tissue length potential. So, that's just one example. There's several manual therapies, but these really are the feel-good therapies, and they're effective. Corrective exercises. These are important. They can relieve pain and restore function. These interventions can help stabilize a weak area, improve mobility of a tight tissue, realign postural deficits. Could be something as simple as learning to engage a core muscle for someone with low back pain or low back strain, or a dynamic exercise like performing a lunge or a squat properly. So here, these are important interventions as well to help with your function and performance, but also in alleviating pain. So in physical therapy, I don't know how many of you have had physical therapy, but also we use modalities, and these modalities often can be used at home as well. A good alternative for pain relief, especially in the acute phase of the injury. So here we have our ice, your heat treatments. Electrical stimulation is something that overrides pain fibers, so reduces the feeling of the pain. And those actually can be used at home as well. Sometimes we might use compression treatment or taping, some other modalities. So these are feel-good modalities as well, and help the injury get on its way. I also want to touch base on the importance of prevention. I looked up a study that was done in Europe, primarily with soccer players, but it showed a 37% reduction in knee injuries with a neuromuscular strength training program. So this included agility drills, core strengthening exercises, ankle and hip stability exercises. So prevention is also key. If we can limit the amount of athletes getting hurt and needing pain intervention, that's a good thing. So this is where, in physical therapy, we would assess a client without any pain and determine if they have any risk factors. A weakness or muscle imbalance, poor mechanics, decreased balance, etc. Then we would intervene with proper training techniques or even some therapy if we feel that it was needed. So just to reiterate with some of the other things that Detective Padilla touched on, and some important tips for these athletes are proper rest, proper nutrition and hydration, proper screening, like preseason screening, making sure the athletes are not at risk for these injuries, proper fitness plan, doing the right exercises correctly so they're not injuring themselves during their fitness, and not playing through pain, listening to your body. I know Sergeant Padilla showed that video of the athletes getting back out there and getting things done, but long term, not the right way to go. You can make it worse and deal with more pain. So again, I want to thank Joelle for inviting me tonight, Uwam for speaking, and Detective Padilla for speaking, and all of you for coming. Thank you.
All right. If we don't have any questions, we know that we are running into about 5 more minutes of the event itself, but we wanted to make sure we provided you with some resources and information. And like as always, feel free to type in your questions. We will see them and we will get to them if there are any. First and foremost, Detective Padilla, thank you so much. We truly appreciate you bringing up the fact that we do have a permanent prescription medication disposal site at the Nutley Police Department. We have a QR code, so if you have a cell phone handy, you can open your camera app and face it towards this QR code right there in the middle, and it will lead you to a map that you can find all of the disposal sites that are within the county itself. So you can see that and have that readily available for you. Along with that, we just listed them all here so that you can have them in one location for you to have. Uh, Very quick ways to do it, either by map or either by the QR code itself. We also have a flyer here, which we've created that shows you all of the locations. I'll make sure to put in the chat box the link to the flyer itself. We'll send you a link to a JPEG version of the flyer. And once again, there's that QR code that you can have. Uh, just we want to make sure that you leave here not just with the information we provided you, but also with some recommendations of make sure even if you don't dispose of your medications right away, that you properly monitor and you secure them. So monitor, keep track of how much of the medication you have readily available to you, and also secure them. Make sure you put them in a secure location. You never know if you have a friend or a family member who might be dealing with a substance use disorder, and they don't want to tell you. They might be ashamed or embarrassed by it, and they might be looking through your medicine cabinet. Might be trying to take if you have a prescription pain medication, as I think the Ted Padilla gave a story about a young athlete who was doing that as well. So this can happen. So please be aware of that. Monitor, secure, and always properly dispose of them. If you cannot make it to your local prescription medication disposal site, you can always mix any medications or any pain medications with old coffee grounds or old cat litter. Try to make it where people do not want to consume it and throw it out in the garbage. Do not flush them down the toilet or down the sink because that can damage the environment. It can damage the water supply itself. So just be aware of that. If you have any questions, we will be looking in the chat box to see if there's any questions that come up. But feel free to put them there. You can always connect with us at Adapt. We have our website, essexadapt.org. You can find us on Facebook, on Twitter, on Instagram, and on YouTube. This QR code here has a link to our events. If you register for this event, you're registered through Eventbrite. And on our Eventbrite page, we have a list of various events that we have coming up here in Essex County for various topics. So we hope that you can join us. This QR code will be available. This presentation will be available to everyone afterwards. We are also doing a community survey to try to get more information and insight into the current challenges or substance use trends that are happening right now due to the pandemic in our county. So if you can scan this QR code, we'll be sending it also out after the event to see if you can help us by participating in the survey. If you live in Essex County, we ask that you please take the survey and share it with your friends and your network. If you also go on our Facebook page, we have that up on our Facebook page as well. At the end of this event, you'll have a post-event survey that's going to automatically pop up. So we hope that you can take just a quick minute to give us some valuable feedback on the event today. And you can always reach out to myself and my amazing staff here at Adapt. We're always here to support and give you as much resources and information as are readily available. Detective Padilla, Dr. Kaufman gave you some great insight. And if you want more information, please feel free to touch base with us and we can give you some more resources. You can definitely get involved in the prevention work that we're doing here in Nutley in partnership with the town and with the police department, or you can work with our efforts that we're doing countywide. So we hope that you can partner with us in these prevention efforts. But with that said, that is the end of our presentation here. I'd like to once again thank you all for taking the time out to participate. In the chat box, we've included a lot of information for you to be able to take. We will be sending out this presentation, and at the end of the event, you will have a survey, a very brief survey to complete. We hope that you do that. But I'd want to thank our panelists once again, Dr. Kaufman, Dr. Padilla, for taking part in this, Ukpa, our intern and student athlete, and I want to thank our partners, Sam Carella from Nutley and the Nutley Municipal Alliance, and Elizabeth Marks, who is the County Alliance Coordinator, along with Director Eileen Fishman from the Essex County Division of Community Health Services. We thank you so much for your partnership and your support in these efforts. With that, we say thank you so much. Have a good evening, everybody. We truly appreciate your time.